Hello, I'm Dr. Sandeep Ojha, and today I want to talk about something that affects millions of people with diabetes, a complication that can be frustrating, painful, and frankly, quite scary. We're talking about diabetic foot ulcers. If you or someone you love has diabetes, you know that even a small sore on the foot can become a serious problem. Because of issues like poor circulation and nerve damage, these wounds struggle to heal. They can get infected and in the worst case scenarios can even lead to amputation. For years we've relied on traditional wound care, but sometimes it's just not enough. But what if we could give your body's healing system a powerful boost? What if we could flood the area with the one thing it needs most to repair itself? That's where a breakthrough treatment called Hyperbaric Oxygen Therapy, or HBOT, comes in. And today, I'm going to explain exactly how it's becoming a game changer for healing diabetic foot ulcers. So, what exactly is HBOT? It sounds complex, but the concept is beautifully simple. During therapy, a patient rests comfortably inside a special pressurized chamber while breathing 100% pure oxygen. The pressure inside the chamber is increased to be higher than normal air pressure. Now, why is this important? This combination of high pressure and pure oxygen allows your lungs to gather much more oxygen than they normally could. This super oxygenated blood is then circulated throughout your entire body, reaching even the most stubborn areas, like a non-healing ulcer on your foot. Okay, so your blood is now carrying a superdose of oxygen. How does that translate to healing? It works in 4 key ways. First, it directly fuels the wound. Think of oxygen as the fuel for your body's repair crew, the cells that rebuild tissue. In diabetic foot ulcers, poor circulation means there's a fuel shortage right where you need it most. HBOT is like sending in a fleet of fuel tankers, delivering a massive supply of oxygen directly to the wound site to kickstart healing. Second, it builds new pathways. HBOT has been proven to stimulate something called angiogenesis. That's a fancy word for the growth of new blood vessels. This is crucial. It's like your body is building new roads and highways to the wound, creating permanent improvements in blood flow, ensuring the tissue gets the nutrients and oxygen it needs long term. Third, it calms inflammation and swelling. That redness and swelling around an ulcer, that's inflammation. While some inflammation is part of healing, too much can slow things down. The high oxygen environment created by HBOT has a natural anti-inflammatory effect, reducing swelling and creating a better environment for healing. And fourth, it boosts your immune system. Your immune cells need oxygen to effectively fight off bacteria. By enhancing the oxygen supply, HBOT supercharges your white blood cells, helping them destroy invading germs and prevent or clear up dangerous infections that often complicate these ulcers. When you put all this together, the benefits are clear. We see wounds heal significantly faster. But the most important benefit? HBOT can help prevent amputations. I cannot overstate this. By giving the body the tools it needs to heal itself, we can often save a limb that might otherwise have been lost. This has a profound impact on a person's mobility, independence, and overall quality of life. So what's a session like? Patients typically have a series of treatments, usually lasting about 60 to 90 minutes each. You can lie back, relax, watch a movie, or even nap while the oxygen does its work. Our medical team monitors you the entire time. Now, like any medical procedure, there are some potential risks, and it's important to be aware of them. The most common is a feeling of pressure in the ears, similar to being on an airplane, which we can help you manage. It's generally a very safe procedure when overseen by a trained medical team, and the benefits for a non-healing ulcer often far outweigh the minimal risks. Diabetic foot ulcers are a serious, complex problem, but they don't have to be a life sentence of pain and risk. Hyperbaric oxygen therapy is a powerful evidence-based tool that enhances the body's own incredible ability to heal. It delivers oxygen, builds new blood vessels, fights infection, and reduces swelling. It offers hope where there was once frustration. If you are struggling with a diabetic foot ulcer that just won't heal, I encourage you to have a conversation with your doctor. Ask them if hyperbaric oxygen therapy might be a part of your comprehensive treatment plan. It could be the breakthrough you've been waiting for. Thank you for watching. Stay healthy and take care of your feet. Like, share, and subscribe for more HBOT information.